plastic surgery questions. And you may notice today we're in a little bit of a different venue. We're actually in my office because they are doing some work out there in the hallways, and you'll hear them. Oh, there we go. The noise come up and down, but we're gonna make it work, guys. We're gonna make it work, okay? So today I'm going to talk a little bit about rib remodeling because it's still we're still getting a ton of questions about this procedure. It's the newest procedure here at Pure Plastic Surgery, but I've been doing it for about since October, so pretty much about 4 or 5 months already with excellent results. We've done plenty of patients and they are loving it. So we're going to talk about the rib remodel, and then after that I'm going to be happy to answer any and all of your plastic surgery questions, okay? So rib remodel, first of all, what is it? So the thing is, it can get a little confusing because you're going to hear several terms out there, whether it's on the doctors' websites, whether it's on social media, and things of that nature. You're going to hear many terms which all mean the same thing. So rib remodel is the same as rib sculpting or rib sculpt. It is the same as rib ex-scar. That's a popular marketing term there for the procedure. It is the same as a bee waist or Barbie waist, and it is the same as wasp waist, okay? So these are all different terms. Some of them are marketing terms, but it's all different terms for the same thing, which is the rib remodel procedure. Now, the one thing that it's not, and this is also very confusing, what it's not is rib removal, okay? And that's like the first thing people get confused about. They're like, oh my God, well, you shouldn't be removing ribs. What about their job and their protection of your organs and this and that? And so that's the first thing I want everyone to fully understand. Not rib removal. The ribs are still faster to do, and so that it can be done in an outpatient surgery setting. And that's what makes it so you're not losing any of the protective functions of your ribs. Okay? But what we are doing is sculpting the ribs or repositioning the ribs in a position where they start off kind of flared out like this, and you bring them in, and that way you can shrink the waist. And this works great for those people that have had, for example, multiple lipos, and they don't have any more fat to reduce, but their waist is not where they want it to be. Or people that start off already very thin, so low BMI patients, athletic patients, who are killing themselves at the gym, but they're still looking straight up and down because their waist is too flared out. And there's no more fat to lose, right? You can kill yourself at the gym, go 5 hours a day, and there's nothing else you're going to be able to do to shrink that waist because it's all about your underlying bony structure that has to change, right? And so finally we have a solution for that is safe, it can be done in the outpatient surgery setting, and that is going to give you good results, okay? So, very clear on that. So what are we treating? We're only treating what we call the floating ribs, which are the lowest 3 ribs. Ribs 10, 11, and 12. And why is that important? Because the higher you go, the riskier it gets. These ribs, 10, 11, 12, for the most part, are not even where the lungs are. Okay? So the risk of things like a pneumothorax are very low. The other good thing about ribs 10, 11, and 12 is that they don't have an artery or vein or nerve associated with them, if they're a true floating rib, okay? So that also makes it less risky because there's less risk of injuring an artery, nerve, or vein, okay? The other great thing about not having an artery, nerve, or vein is that it doesn't produce a lot of pain. And that's the next question that we get. Oh my God, you're cracking ribs. Isn't that extremely painful? Well, not if you're focusing on ribs 10, 11, and 12. Why is that? Because they don't have a nerve associated with them, right? It makes sense, okay? So, we're treating only the floating ribs, and what's really made this really cool is that now we have the technology to make this a scarless technique, which is absolutely incredible. I mean, just think about it. We're doing a controlled fracture of the ribs, we're repositioning the ribs, and we're doing all that through a needle hole. An 18 gauge needle hole, okay, which is a virtually scarless technique that is truly amazing, okay? And so that's what we're doing now. We're using a special tool. It's called a piezotome. So we're using that special tool to create a controlled fracture, and I'll show you here with this little example of the markers. But if you look at a rib kind of head on, it looks like this, right? It has an outer cortex, an inner cortex, and it's kind of hollow in the middle, right? And so what we're doing is we're only creating a very controlled fracture of the outer cortex with this special device called the pisotome. And that device is really cool because it can only affect bone. It cannot affect surrounding tissues. And so that pisotome then allows us to make that controlled fracture like this. Okay? So it's not a fracture like this. Actually, the bottom part stays together. So we're doing this very controlled fracture. And so we're able to make the angle, if you have a wide angle, into an acute angle so you can have acute waist. That's right. Okay? So we take a wide angle into an acute angle so you can have acute waist. Okay? So that's what we're doing. It's a scarless technique. But there is a commitment by the patient. A commitment that is non-negotiable. Meaning you have to commit, because if you don't commit, you're not going to get the result. Okay? And so the commitment is that you have to wear a corset for 3 months. You have to wear a corset for 3 months, night and day, basically 23 hours a day. All right? And that is non-negotiable. You have to commit to that. If you're not going to commit to that, don't get the procedure. Okay? So yes, corset for 3 months. So what is some of the post-op care? So when do you start wearing the corset or the garment? So by the next day, so post-op day 1, we typically combine this with Lipo360 and BBL. So what's going to happen on post-op day 1 is that you're going to put on your foams, your faja, and then the corset. So foams go first, then your faja, and then the corset. Okay, but the goal for you for the corset is that you're going to be tightening this corset 1 centimeter a day for the first 10 days. Okay, so they typically have like several little hooks or they're Velcro. You'll be able to like mark them out and be like, okay, this is day 1. Now day 2, another centimeter. Day 3, another centimeter. Day 4, another centimeter. You get the picture. And you're going to do that for 10 straight days. So that you can reduce that waist by 10 centimeters. So you're going to do that for 10 straight days, and then you're going to stay there, and you're going to stay there for the next 3 months. Some patients elect to do a little bit more, and it is okay to maybe go 11 or 12 centimeters, but we do not recommend going any further than that. Okay? So the max probably is going to be about 12 centimeters. Now, if you combine it with your BBL, which is the most common combination that there is, then it is okay to massage. That's the next question we typically get. Oh, doc, can we get a massage if we do the river model? And the answer is yes, absolutely. So you can start your massage in the same way you would with a regular BBL. You're going to start your massage the next day, and then you're going to have 20 massages minimum to optimize your results. Okay? And the cool thing about this procedure is that it can reduce your waist. It can reduce your waist by 8 to 12 centimeters, which is amazing. Okay? An 8 to 12 centimeter reduction in the circumference of your waist with this procedure. And that's truly incredible for those, like I said, that have had, especially those that have had multiple lipo, those patients that are lower BMI, so BMI 25 or below, or those patients that are athletic and they have mostly muscle, not a lot of fat. This is like the only way, not the only way, but the best, safest way to be able to reduce that waist. Okay? So, happy to take any questions.
All right. Few comments, dad joke, funny. Sound, I know the sound is hard. After lipo, if I gain weight later on, is it likely to show up more in untreated areas like my arms or chin?
Yeah, to a certain extent that is true. So as we become an adult, we have a certain set number of fat cells in our body. And what happens when you gain or lose weight is that those fat cells become bigger or smaller. But then what happens with liposuction is that you are permanently removing the number of fat cells from the areas that you do the liposuction. So in the future, those areas where you did lipo have a less number of fat cells in comparison to the areas where you did not do lipo. So if you were to gain weight, then yes, you will probably gain more weight in the areas that were not lipo. For example, if you didn't do it, the chins, the arms, or say the legs, for example.
Thank you. What can I combine with the river model?
So that's a great question. And so the most common thing that we combine is either Lipo360 or Lipo360 with fat transfer, which is BBL. That's the most common combination. That's actually what we call here at Pure the BBL 2.0, basically taking that BBL to the next level. And within that BBL, you can combine it, of course, with skin tightening or high definition liposculpture as well. But you can actually combine the rib remodel with pretty much any procedure. You can combine it with your breast procedure, for example, breast augmentation or breast lift with implant. You can combine it with your tummy tuck, with your mommy makeover. So you can really combine it with most procedures that we do.
Thank you. I had a breast lift 7 months ago,
Yes.
and my right breast is higher and a little bit harder than my left.
Was it? I'm not sure it was a breast lift with implant. It might sound that way, but the first thing
Yes,
I would do
with
is
implant.
With implant, right? Okay.
Yes.
All right. So first thing I'm gonna say is start with massage. You want to massage the area that's higher. Massage, and see if that's gonna help. If you feel that it's hardened, there may be an early capsular contracture, and of course discuss this with your surgeon. But if it is or looks like and feels like an early capsular contracture, you can also try a certain medication that helps with that. And then if the massage and the medication, don't do the trick and it's been over a year, then at that point in time you may have to consider going back to surgery to remove the capsule.
I need a breast lift. Can I also do a lipo at the same time?
So, the short answer is yes, but it depends on a lot of factors, and so we got to really do an evaluation and determine whether that's going to be the best combination for you. For example, if you want to do a complete full body lipo 360 with the breast lift, you got to keep in mind that in Florida we have certain rules, and one of them is that if you combine it with a breast lift, or we can only remove 1,000 cc's or 1 liter of fat. Okay. So I would say, but if you're lower BMI, then maybe it doesn't matter, right? So the best thing to do is to, go to our website, go to our virtual consultation, fill in that questionnaire, send in your photos, and then we can create the best treatment plan for you.
Can this procedure, the rib remodel, be done if I've already had a BBL and lipo 6 months ago?
Yeah, certainly. So of course you want to make sure that you're fully healed from your prior procedure, right? From your lipo and your BBL and everything else. But if you're completely healed, you're doing well, you're all recovered, then yes, this can definitely be done.
Is tenting common in the early stages when doing a bigger implant?
So yes, it's not uncommon to see some. I think you're talking about tenting here in the middle. It's not uncommon to see some tenting there, especially if you're putting a large implant. In the early stages, say within the first 3 months or so, because there's also a lot of swelling that takes place in that area. And there may be some bruising there as well. So I would say if you're early post-op, you can help it along a little bit, like maybe put in like a rolled up gauze or something just to help decrease some of the swelling. So kind of place something in between the breasts there as you put on your bra. But then of course give it time and wait till about at least 3 months and then evaluate the area.
How long is a tummy tuck with muscle repair and hip dip procedure?
So, okay, tummy tuck, muscle repair, that's part of your tummy tuck. That part's all about an hour and a half. And then adding some fat grafting to the hips at that time, it's probably going to be about 2 hours.
Okay, thank you. Back to the rib remodel. What's the age limit for this?
Oh, great question. So there is one thing that we have to consider, right? And especially in women, as you get older, unfortunately, the bones become more brittle, right? Osteoporosis, okay? And so you don't want to do this procedure in someone that has osteoporosis or where the bones are brittle, because once you do that controlled fracture, it may not heal, okay? Or it may not be as controlled because the bones are too soft and too brittle. So for that reason, yeah, there is an age limit. The age limit is going to be 45 years old. Okay, so we're not doing this procedure in patients that are older than 45 years old.
How long does the itching and tingling sensation last after lipo 360, and when does it typically start?
It sucks, right? Yeah. So first of all, for those that may not know, it's not uncommon. You can have tingling, you can have itching. Actually, that's very, very common after lipo 360. And what can sometimes be the frustrating thing is that it can last for a while. It can easily last 3 months for sure, but in some patients it can last even up to 6 months or more. So it's not as intense, obviously. It's obviously a lot more intense at the beginning, but you may have some tingling, some itching, sensations even up to 6 months out.
What about bimaxillary osteotomy? I saw TikToker guys talk about doing it, and I'm very interested.
Okay, so I'm gonna be honest. I don't know a lot about that procedure because that's a head and neck procedure, and I do most of my surgeries are from basically the chin down. Okay, but if you're talking about maxillary osteotomies, what we're talking about is creating some breaks in the bone here. Typically, when you have like a recessive chin, and they can do that to kind of pull out the chin, and it's a good kind of permanent solution for that. And yes, I mean, what I would say, it's a very established surgery. You definitely want to go to a what I would call a facial plastic surgeon who has a lot of experience with those procedures.
Thank you. How can you determine if you only need Lipo360 versus a tummy tuck?
Right, so that's a very, very common question, and so what you have to answer is, okay, number one, are my muscles weak or separated? If the answer is yes, tummy tuck. If the answer is no, okay, question number two. Is my skin very, very loose? If the answer is yes, tummy tuck. All right, now what if the skin is not very, very loose, but somewhat loose? So the good thing is that nowadays we have skin tightening devices that work pretty well for mild to moderate loose skin or skin laxity, okay? So if you're like moderate plus to severe, tummy tuck. If you're mild, moderate, then we can do the lipo, and we're gonna add a skin tightening procedure such as quantum or J-plasma.
In your opinion, do hyperbaric chamber sessions help with healing of a Lipo360?
Look, it'll help. There's typically not a downside as long as you're going to a reputable place that knows what they're doing. And remember, there are risks to hyperbaric chambers, especially if you go to someone that has no clue what they're doing, okay? But say you're going to a reputable place, they know what they're doing, okay? It is gonna help because, it increases the oxygen tension, which increases healing. But honestly, I don't think it's necessary for most patients. I think it's the extra step, the extra mile, the extra cost, and honestly, I don't think it's necessary for the majority of patients.
Thoughts on a lip lift? Some plastic surgeons won't do them. Where is the scar?
Yeah, so Dr. Vidal does a beautiful lip lift, okay? Dr. Vidal, a permanent viewer of pure plastic surgery. If you're considering a lip lift, I would highly recommend doing that virtual consultation for Dr. Vidal. She does a beautiful lip lift. It looks very, very natural, and she hides the scar just underneath the nostrils in a way that it's not very visible at all. So she kind of hides them right underneath the nostril there.
If my surgery is Monday, when should I be there?
So so for Monday surgeries, you have to be here Friday. So you have to spend the weekend with us. But the good news is, okay, and that's going to be for Dr. Vidal and Dr. Wigger because I don't do surgeries on Mondays. But the good news is that you can spend the weekend on us. Okay, we have a promotion right now that if you book your surgery for a Monday, yes, you have to come in for your pre-op on Friday, but guess what? We're gonna comp your hotel stay for the weekend so you can enjoy some time here in Miami and then have your surgery on Monday.
What are your thoughts on awake breast augmentation?
My thoughts are that it's coming, not quite there yet. Okay, so with the current techniques that we have available right now, I wouldn't necessarily recommend it, but we are very excited about a new technique that we're going to be doing in about a month, okay? And it's called the Preservate technique with Motiva, and that is a technique that's going to be able to be done very, very comfortably with the awake patient. So we are super excited about that. If that's something you're interested in, stay tuned. Okay, because we're going to be bringing that to Pure by end of March, early April.
Is there a reason why some surgeons don't allow people with MS to undergo surgery, and some do allow it? Is it something that's concerning? Thank you.
So yes, that is absolutely correct. Some surgeons are not comfortable with it. For example, myself, I don't do surgery on people with multiple sclerosis. Other surgeons perhaps are more comfortable, or they have a different setting. My setting here is an office-based outpatient surgery center, meaning that from here you have to be able to go home. And that's the worry, right? If you have MS, you undergo general anesthesia, you may wake up in a way that you're not able to take care of yourself, okay? And so that's gonna be an issue, right? There's no place here to stay, not even overnight. So I think that's the main thing there. If you go to a surgeon who does your surgeries out of a hospital setting, then perhaps they're okay doing the surgery for you.
Are you board certified or double board certified?
I am double board certified, so I am board certified in general surgery, and most importantly, I am board certified in plastic surgery.
Where are you located, and what university did you attend?
Oh wow, okay.
I think they're trying to get to know you.
Yeah,
Some TikTok
of course.
listeners.
I would love, like, go to my website, you can see my entire CV, okay? But I'm in Miami, and I went to some of the top schools and training programs in the nation. So I went to Princeton, I went to University of Miami, NYU, and Duke for my entire career. So Princeton undergrad, NYU for med school, University of Miami for general surgery, and Duke, which is probably the top program in the nation for plastic surgery.
Thank you. If I get lipo 360 plus arm and chin lipo, will I have loose skin?
I mean, you can certainly get lipo 360 arm and chin lipo, and so the question is, will you have loose skin? It's about how much skin laxity you have in those areas, okay? So if your tummy stays fairly tight, or you have some skin laxity in the chin, and maybe some in the arms, like if you do this and the arm kind of flaps, then maybe we do your typical lipo 360 with the Vaser, but then for the chin and the arms, we add the skin tightening like the Quantum or the J Plasma, right? So for any of the areas that have like mild to moderate skin laxity, we should add some additional skin tightening procedures. And the Quantum and the J Plasma can provide up to 60% skin retraction to those areas, which is very significant and which has allowed us now to basically open up the patient pool of those that can do lipo, as opposed to say a tummy tuck, an arm lift, or a facelift, with the addition of these skin tightening procedures.
What do you think about lipo 360 with Renuvion on thick thighs?
Yeah, so I do like that combination. So you can do your lipo 360, you can do your thigh lipo if they're very, very thick. Typically, for the most part, for most of my patients, the majority of the lipo is done in the inner thigh. You want to be then careful with the anterior thigh and the lateral thigh, okay? But if you have very, very thick thighs, then that can be brought down as well. And then you want to add something that's going to help the skin stick back down, which is where you're adding that skin tightening to those areas as well.
Thank you. What's the massage schedule while in Miami after surgery?
So while you're here, you're going to get one daily, right? So you're going to start on post-op day 1, so the day after surgery. You should get one daily for the 5, 6 or 7 days that you're going to be here after surgery, all right? And then those first, for lipo 360 and BBL, you're going to need a minimum of 20 massages. The first 7 are daily. The next group of 7 are every other day, and then the last 6 or so are going to be weekly.
How soon after a mommy makeover can I get a BBL?
3 months. That will be the soonest. Of course, you can do it anytime after that.
For consults, do you have to do virtual or in person? And if it's virtual, is it Zoom or video?
So you can choose. So there's 3 ways to do consults here, okay? One is what we call the virtual consultation, but that one is completely online. So you go to our website, you hit start your journey or virtual consultation. You're gonna send in your contact information. You're gonna fill out a questionnaire, and you're gonna send us some photos. And then based on all that information, I'm gonna take a look at everything and come up with a treatment plan. And then you'll hear from my coordinator, and she'll put everything together for you. That's option number 1. That option costs $0. Option number 2 is the video consult. So that's the one that we can do through Zoom or something similar. We actually have a HIPAA compliant system that we use here called Clara, so we do it through there. But you can do a video consult, and that's where we're talking through the video. And for that one, there is a fee of $250. But if you go ahead and book, that goes towards your surgery, so you're not losing out any money there. And then yes, you have the option of coming in person, and then that one's also going to have a fee. The fee for the in-person, so here in the office of Pure Plastic Surgery, the fee for that consult is going to be $500. Same deal though. If you book the surgery, those $500 goes towards the surgery, so you're not losing any money there.
All right, thank you for the last question.
Last question
today. Yeah, that's fine. After, let's see. Okay, this one. After getting the flu, how long should you wait to get surgery?
Oh, all right, good question. I mean, I'm going to give you an average. It depends how severe it was and everything else. But I would wait at least 2 weeks. Make sure that you're fully recovered, fully hydrated again, that you're not having any cough or phlegm or anything like that. But again, caveat, I would probably ask you to run it by your primary care doctor and make sure that they give you the medical clearance that is necessary. And because there's different flus, right? There's the flu where you stay home for a couple of days and then you start bouncing back, and there's the flu that puts you in the hospital, right? So there's a huge range there. So it's going to be taken on a kind of case-by-case basis.
All right, thank you very much.
We're good?
We're good.
All right, so everyone liked the joke? We're gonna.
Yeah, we had a couple that reference a dad joke.
That's right. We're gonna make the acute angle so you have acute waist. That's right. All right, everybody. So that was great. And so remember, we're here every single Wednesday. That's why it's Hump Day around 4:30 p.m. And I'm happy to answer all your plastic surgery questions. Okay.